What is CURB-65 score? So the CURB-65 score is a score of community-acquired pneumonia. Why is it used? Community-acquired pneumonia. Why is CURB-65 score used? It is used to determine the severity of community-acquired pneumonia and to determine the level of care that has to be given to that patient. The level of whether patient has to be dealt as an outpatient, or maybe the patient needs hospitalization in general medical ward, or the patient may needs a care of ICU. So what are the components of CURB-65 score? Confusion, any new onset confusion. New onset confusion. If there is any new onset confusion, the patient has 1 point. Blood urea nitrogen or uremia or raised urea levels 19 milligram per deciliter or more, then the patient is having another 1 point. Respiratory rate of 30 or more than 30 per minute. Blood pressure, systolic blood pressure of less than 90, or diastolic blood pressure of less than age 65 or older. Now, what if the score is 0 to 1? Each of these are have one score. So almost 1, 2, 3, 4, 5. Total score is 5. So if the patient is having 0 to 1 score, it may be as an outpatient. If the patient is having score of 0 to 1, the patient may be dealt as an outpatient department. Now coming toward the score, if the patient is having 0 to 1 score, the patient will be dealt as an outpatient. Now the score is, if score is 2, then the patient may need hospitalization, but in general medical ward. Now if the patient has score of 3 or more than 3, the patient may need ICU care. So this was all about the CURB-65 of community-acquired pneumonia. It is used to determine the severity of community-acquired pneumonia and the level of care. Either the patient has to be dealt as an outpatient, as an hospital medical ward, or an ICU candidate. So what are the components? Confusion, urea, respiratory rate, blood pressure, and age of 65 or more than 65. Any new onset confusion has 1 marks. Any raised in urea will have 1 mark. Respiratory of 30 or more than 30, it's again 1 point. Blood pressure of less than 90 mm of mercury, systolic blood pressure of less than 90, and diastolic blood pressure of less than 60 millimeter of mercury will give you 1 point. Age greater than or equal to 65 have 1 point. So these are the three score categories. So from 0 to 1 score, deal the patient as an outpatient. If has 2 score, hospitalize the patient in medical ward, but maybe there is a possibility to shift it into ICU care if the score becomes 3.